Webster of the Conversation Project is with us today to talk about how communities and community groups can support advanced care plan discussions using resources from the Conversation Project. You're connected with the Heart of Hospice. I'm Jerry Venter, here with Helen Bauer.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
So our conversation today with Patty is all about how communities can reach out into their community and help people make their advanced care plans, because we know it's really important to do this.
So Patty Webster is an improvement advisor for community engagement and learning for the Conversation Project. In her job, she coaches community partners, she leads the monthly community calls, and she also supports the team's knowledge management and measurement, learning, and dissemination efforts.
She shares the Conversation Project's message and resources through various speaking engagements and workshops all across the country. So she really wants to get the message out to people that in their community, whatever organization they're with, whether it's something as small as just a book club or something that maybe a hospice organization would want to do themselves, they give them the resources that's available through the Conversation Project so that they can take this message out into their community. And we encourage this, whether it's a community of faith, whether it's an organization like a hospice agency, or whether it's something as small as a book club or a senior citizens group.
So here's our conversation with Patty Webster of the Conversation Project.
Patty, we're so glad to welcome you to the Heart of Hospice podcast for this series on talking about advanced care planning. Thank you for joining us.
Thank you so much for having me. It's such a pleasure.
So you're the improvement advisor for community engagement with the Conversation Project. So tell us why you think it's so valuable for communities to have these end-of-life discussions.
Yeah. So we learned early on when we set out our mission for the Conversation Project, we want to help everyone talk about their wishes for care through the end of life, so those wishes can be understood and respected. That's our mission. We started with raising awareness and providing tools for folks, but we quickly realized that to talk about this really requires deeper change and shifting the norm from not having these conversations to really talking about it early and often. And to bring about that national change, we knew really quickly that we needed to reach people where they live, work, pray, and learn. And so we use those because those are the communities that we have learned that are bringing the conversations in and really reaching people where they're at. And so the communities that we work with really have helped us learn that they can help normalize these conversations across their settings through a support system. And so it's a support system for individuals, whether your community is in a county, whether it's your family community, whether it's a statewide. And it's really that kind of everyone's doing it mentality, that support system. If you're reaching people 8 times, 8 ways, that actually helps people normalize these conversations. And we know that communities really know best how to reach people within their communities. So it really is from the inside out that we know this is important. I can give an example of the value in normalizing these conversations from Howard County, Maryland. We have a phenomenal group that's really doing a countywide collaboration. They started a couple years ago. It's called Speak Easy Howard, and they work with hospitals and faith communities, local organizations, and their goal across the county is really to help everyone think about and talk about their preferences for healthcare and have a healthcare proxy. So that's kind of their community goal. And so all these different groups are reaching those individuals within their specific target. And so they're sharing messages and resources, hosting events. And so an example, a gentleman walked into the ER. He had a healthcare episode. He walked in, the ER clinician, because they're part of this collaborative, say, hey, do you have a healthcare proxy? We really want to know what your wishes are. And he said, oh, we had those conversations at church. So yes, we do. And so that's what I mean about normalizing it. When wherever you go in Howard County, people are really talking about that. And so you feel that sense of everyone's doing it. I want to jump on that bandwagon.
That is awesome.
I love that.
So tell us the materials and the resources that the Conversation Project has available to make these community conversations easier.
We have a plethora of resources. And so you'll see on our website, so we've got resources for individuals. And so we've got our conversation starter guides. Those are kind of our flagship tools for individuals to help have these conversations. And then we have a whole page for community members. So it's our Get Involved page. And so we have resources for faith communities. We have resources for communities at large. So community-based organizations, individuals out there who are doing this. And then we have resources for healthcare groups. Those are kind of our three main buckets that we see are doing a lot. And with those resources, we have a champions map. So it's called a Conversations Champions Map. And so we've got a map, not just the US, but a world map, because it reaches outside the US, of individuals and organizations who are already bringing this to their communities. So you can search the map and see, who's located in Houston that I can tap and connect with. Not everybody who does this is on that map. But we also have a Facebook discussion group. So we have a support system so folks can reach out and talk with each other on a discussion group. We used to have calls. We don't do those as often, but we have recorded webinars, training and resources for folks. And so we have resources. And one of our biggest resources for community members is a Getting Started guide. So Getting Started guide for communities. How do you bring this to your community, whether it's your personal circle, social circle, or your larger spheres of influence? And that guide really introduces people to the importance of conversations and how might you approach this in your own circles. And whether you're an individual of one who wants to reach 5 people, or you're a team of 10 who want to reach across your county, as in Howard County, and many other groups are doing this, or across your state. And so we have examples and learning from all of these groups have been doing it for years. And so we have been super blessed because I joke that our group is like a honeybee. We cross-pollinate ideas. And so this guide collects the ideas from so many different individuals and organizations that have been doing this and what works to help reach people. We put those lessons in our guide. And so we're the bees, cross-pollinating those ideas. We also have a recorded session that you can listen to that helps you walk through that guide and give you tips and tricks on reaching the community. So it's a little bit more of it's not live because it's recorded, but it gives you a little bit more of a hand-holding if you need that. We have groups that are actually hosting workshops and bringing materials in a more deeper way than just passing out materials. And so we have a tips for facilitating and teaching guide. And so that, again, is pulled from all these community groups. And so we have the top 10 tips on bringing this to your community and the messaging that goes along with that. We share stories in there. So our work is really stories based. And so we have stories that people can use if they don't have their own stories. And then we have some common questions in that guide. So everything we have is absolutely free. We want this to make it really easy and ready-made for folks. So if you're interested in bringing it to your book club, go there and find resources. And so we don't want people to reinvent the wheel. We want to make it really easy for people to bring it to their community.
So when you say community, I immediately think big, like the entire city. And you're thinking about community as groups, smaller groups. That's really pretty valuable because my first thought was, what types of professionals should be starting these conversations and utilizing these community conversations. And really, it doesn't have to be professionals. It can be anybody in the community. You can be a member. You don't necessarily have to be a big leader, somebody who's prominent in your community, but somebody who just wants to bring this conversation to your group.
Absolutely. And I mentioned it before. So start small in your personal circle. So think about where do you meet? Are you part of a book club? Do you have a social group that gets together? I have ladies that go out, ladies' night. And so hosting a death over dinner. So there's a great organization that has resources to host death over dinner. It's literally conversations and conversation starters over dinner. And so there's other resources. There's tons of great resources beyond our resources that we promote as well, because there's no one size fits all. So we think about personal and social circles. You can bring our conversation guide. I had a friend who brought their guide, that was their book to read at their book club. And so folks took a look at the guide ahead of time, and they came together and talked about, they filled it out and they talked about their wishes at the book club. You can also, read Being Mortal by Atul Gawande, read that book, and then use the starter guide as a take home, as an action. So there's lots of different ways. So that's the small. But then, as you mentioned, expanding larger. So what are those larger spheres of influence? So folks are bringing it to neighborhood associations, Rotary clubs, and Lions clubs. They host meetings regularly. So we see people piggybacking onto those meetings. And then we have a whole host of professionals. So you asked about what sorts of professionals are bringing this. I talked earlier, we've got healthcare, which kind of is the natural fit. People think about, okay, it's just for healthcare. It's not just for healthcare, though. I'll talk a little bit about healthcare, but we also have a lot of professional service organizations that are doing this. So financial planners, legal services. So we've got elder care lawyers and estate planners who are bringing this to their clients, insurance agents who are using this as part of their package, because this is really planning ahead. That's what insurance is about, is that risk benefit, right? And so we've got financial planners who basically one of our colleagues, her financial planner, first meeting they had with her, introduced a lot of different resources for financial planning and the conversation starter guide, and said, this is a great way to plan ahead. And she was thrilled because she was like, I know this organization, I work for this organization.
Right.
And so a lot of professional groups are bringing that. And it's a really good way to build relationships with clients and families, because this is a family, your chosen family conversation. We see senior service groups bringing this to their clients. And so groups like, there's a group in Martha's Vineyard called Healthy Aging Martha's Vineyard. So there's a lot of groups across the U.S. who are helping seniors age in place and active living. So Healthy Aging Martha's Vineyard, they have a collaboration across hospitals, community-based organizations, representing the diversity within the island, including their local NAACP. These groups are working together to host workshops for the general public. So deeper workshops, and going through the guide and working with them at an actual interactive workshop. Faith communities are having conversations. They all come together and share across their community. So it can be as big as, Martha's Vineyard's not that big, but it's bigger than just your social circle. Healthcare groups, though, we really do see a lot in healthcare, and it can be within the whole spectrum of healthcare. You all know hospice and palliative care, absolutely natural fit. We've got groups that are focusing on specialty care. So we have a couple community members who are cancer centers that are hosting workshops for their patients and caregivers, in addition to staff members. So we had one that was did a virtual workshop, an hour long, just introduced the concept of value-based conversations. And that's what the Conversation Project's all about. And hosting that workshop for the patients and for their caregivers at home. We see primary care physicians that are bringing this into an office setting. So we had one group who was offering this at their annual wellness visit. So they were actually putting conversation guides or whatever resource that you want to use into a wellness packet for their patients. And that's something that they can either look at ahead of the appointment or post-appointment as leaving an action. There was a group in Hawaii. So there's a wonderful group, Kukua Mau, who does work across the islands. They were working with their healthcare teams. And so the specialty groups didn't know how to have these conversations, weren't sure if they wanted to do that. And Kukua Mau said, refer them out to us. And so Kukua Mau hosts community workshops. And so these specialty clinicians were actually writing prescriptions saying, attend this community workshop to really think about and talk about wishes for care. And so there's lots of really creative ways that people are doing this to help their clients.
That's awesome. I love the prescription one. Very cool.
I think super clever. I'm throwing a lot at you.
No,
it's great.
This is great. I think it's good to have all these examples of how people are utilizing the resources for community conversations because it sparks people's information. They don't have to do it exactly the same way that someone else is doing, but they could start there and feed off that idea and create whatever suits them the best. I think that's really good.
We've seen so many really unique ways that people are doing this. So there's a hospice and palliative care social worker that we knew who around National Healthcare Decisions Day, and I don't know if you all have talked about that before, but on April 16th every year, it's a national day for really talking about and thinking about your wishes for care. And so she hosted a table in the hospital that she worked at, the hospital that was working with the hospice. Every NHDD, she hosted a table, and people loved and basically gave out information, provided conversation starter guides and advanced directives. It was such a hit that she went to the CEO and said, hey, can I make this bigger? Can I do this drop-in once a month? And it turned into what she called this coffee and conversations. And she worked with the Oban pen that was in the hospital lobby. A lot of the healthcare systems have food. Food is a real big comfort when you want these conversations.
Sure.
So she hosted this coffee and conversation and had resources, not just for patients and carers coming into the hospital, but also for staff members. And so people would come and they could come back the next month, talk about it. And she was there as a social worker to talk about this. She had documents that they could fill out. She invited a notary to do notarized documents if needed. And so really like lots of different creative ways that people can think about this. She did this as an individual. And so you can do lots of different things.
You know what this makes me think of is having all these resources that are easy to use. They're variable. You can use them wherever, your bridge club, your social circle, your business. This social worker started this at her hospital where she worked. They're so flexible that you can take them, make them whatever you want. And the fact that they're free, you guys at the Conversation Project have reduced the friction that it would take for somebody to have these conversations. The conversations are hard, right? On a personal level, we know that. We've seen it as professionals. We've experienced it personally. We know what that's like. But you guys are reducing some of the barriers that might get in the way of people having the conversations. And that's really a huge resource, a huge asset when it comes to creating end-of-life wishes. I think that's so important.
Yeah, it's a good point because we're trying to pull that medical clinical out of it and really focus on values because the values conversations really is what resonates most. We know from, there's been a lot of messaging research on how do we reach people? And what the messaging research tells us is people really relate to stories. Don't lead with death and dying. This is really all about life and living. And the framing of this is so important. It really is, it can be a really positive, it can be really difficult, as you said, but leading off with the positive and with that motivation. And so that you've got a support and there's lots of different ways to do this is really important for people. We also know that planning ahead and that sense of control in a situation where we don't have a lot of control, end of life, we don't necessarily have that control, but having these conversations are a way to help those that may have a say in our decision and our loved ones have easier time and initiate these conversations. And so one of the things that's really big and what was really important to us is we've shifted over the years. Our guides used to be, you could take our guide, use it as you wanted, meaning as is. We've shifted that and we've made our guides editable. And so a community can take it and say, what do I want to add or take away? Or maybe I just want to take 3 questions because I know this is what's going to resonate with my people. And so we've made our conversation starter guides editable so community members can take and do what they want with it. So we had Cleveland Clinic is doing some really fantastic programming right now. And they asked if they can put a little bit more clinical because they know what's really important for some of the patients and the families that they're doing. So they're going to add some clinical into it. They had some really good word choices based on what they know is going to resonate. And so it's important for us to that's why we wanted to kind of shift the way that we have our guides and our resources so people can use them as they will. The same with all of our other community resources. So we have slide decks, we've got agenda templates, we have case studies, we've got ready-made promotional materials that people can take, edit at will, and use. So we just want to give them a little nudge to help it make it easier for them and make it your own.
I really love that the Conversation Project has all of these resources available and for free. All people need to do is just go in and download it. And you have made it so simple, so easy for them to do this. And the resources are so comprehensive. I just have to give a shout out to the Conversation Project for doing this and doing it in such a friendly and an easy way. So, Patty, one last question we want to ask you. If someone decides to do this, if in their community, whether it's just a small group or whatever, what's the first thing you would recommend that they do themselves before they bring these conversations to their community or their group?
We really recommend that you walk the talk and do this for yourself. And so take our guide or other resources. You don't have to use our guides if they don't resonate, but there's lots of good resources out there. But think about what is important to you, what matters to you in life and in care that you want to make sure someone knows if you can't speak on your behalf. You go through the guide yourself. We've got really good prompts. Think about it for yourself and then pick your person. So who might speak up for you if you can't? So think about it. If you haven't thought about who your healthcare proxy or healthcare agent, depending on where you are, think about that and have that conversation. And so we can't emphasize that enough. We and all of our community groups start with that as well. Without having those conversations yourself, you don't know how challenging they may be or what comes from those conversations. And so we have to do that at the Conversation Project as well. And so I started this work because of end-of-life experiences we went through with my mom. And I'm super passionate about this, but I hadn't actually had these conversations with my dad or with my husband or with my kids who are 18. And this is for everybody. They need to have that. And so before I started this work, I had to say, okay, we need to do this together. And so having those conversations made me realize that for my dad, it was so hard. We had to do stop and start, and we had to reorient the way that we did it because he's very different than the conversations I had with my mom. My mom, we called the conversation queen. She talked about her values all the time because she was in healthcare. She was a nurse and then hospital chaplain. She was kind of a combination of your backgrounds.
Yes.
And she knew how important these conversations were. So for her and us, it was really easy to talk about it, but not so with my dad. So if we don't have these conversations first before we support others, we don't know what others are struggling with or going through. This is the one thing that we can all relate to each other. It's the human condition, right? We joke that the Onion, do you know the Onion? It's a satirical newspaper.
Yes.
So it's all satire. It's all pretty funny headlines. The Onion has a headline that says, "Death rate holds steady at 100%. And so we're not getting out of this. None of us are going to, unless you have a magic pill, none of us are getting out of this. And so if you are able to do those conversations first, you then are better able to support others and share your story. So I always talk about the conversations I had with my family members to put someone at ease and help them understand, like, hey, I can relate because I've done it myself. So I encourage anyone to use their story, and that opens up conversations with clients, with their community members, with your social circles, with your listeners.
So, Patty, what's the best way for our listeners to connect with the community resources that the Conversation Project has? How can they find them?
So first, just jump onto our website. So it's theconversationproject.org. Come onto our website and peruse. There's a tab that's called Get Involved. And so if you go to our Get Involved tab, that hosts all of the community resources that I mentioned, and just kind of play around there. We've got a whole host of resources under healthcare, faith, and community at large. And then we have an actual community orientation webinar. So you can listen to a webinar and I walk you through the website to help give you a little orientation of all the things that we have and some of the common questions that people have. And so that's a resource that you can tap into. And people can always get in touch with me directly as well.
Awesome. We'll have a link to the Conversation Project website in our show notes and make it really easy for our listeners to connect with you.
Fantastic. And we're on social media so folks can follow us. And we also, if I didn't even mention that, We provide tweets. We have social media kits. So people make it really easy. If you want to just use social media and that's all you want to do, you just want to send the message out, we make it really ready, available for folks. And so we try to make that easy as well. So if people follow us on Instagram and Facebook and Twitter, we'll make it easy for you.
Patty, thank you so much for joining us today.
Thank you so much for having me. It's such a pleasure, and you all do such incredible work. And so we're just really, we're happy to be part of this and to help in any way we can.
So I learned a few things today.
Did you?
Yes,
Tell
I
me.
did. Well, when she said communities, right, I'm thinking whole cities. I'm thinking counties. I'm thinking even states, large organizations, large groups of people. But a community can be something as small as the 8 people that are in your book club, the 10 people or 12 people, I guess, if you, that play bridge together.
Right.
It can be a hospital. It doesn't have to be related to a hospice agency. It can be any organization. It doesn't have to be a healthcare organization.
Although many healthcare organizations are the ones who are involved in this and leading these.
Right, and they can use these resources. I also did not know that the Conversation Project had tweaked their resources that are downloadable so that they are editable, which means they can be edited so that people can customize the questions and the prompts and the conversation starters so they're appropriate and meaningful for that particular community group.
Right, because each culture might have a different way of looking at things and different things that they want to discuss that might not even be in the guide that's given by the Conversation Project.
Right. And when we say culture, we mean group culture.
Right.
Right. So we would really encourage you to take advantage. You are part of a community, whether it's a faith community, a book club, a family, a place that you're employed, a group of friends. Take these resources to your community. But remember to follow Patty's advice, which is to do your own advanced care planning first.
Exactly.
Right.
Exactly. That's the important part, is doing it.
Right. What's the saying? Put your mask on first.
Right.
Right. Right. So we would encourage you to go to theconversationproject.org and connect with the community resources on the landing page they have there. If you scroll down and on the right-hand side, there's a big bar that says community. You can access all those resources there. We would really encourage you to take advantage of all the resources the Conversation Project has to offer.
Thanks for listening to The Heart of Hospice. I'm Jerry Fenter here with Helen Bauer. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening and leave a rating or a review on Apple Podcasts.
To connect with us, just send an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.